A new study published in the BMJ has revealed that individuals previously infected with COVID-19 have an elevated risk of developing potentially fatal internal blood clots for up to 6 months following an infection, even if only mild. This expands upon previous research by revealing just how long the risk of developing such complications can linger on, even after recovering from the initial infection. The study saw researchers analyze data from 1 million medical records of individuals in Sweden who were infected with COVID-19 between February 2020 and May 2021, and compared them against 4 million others who hadn't yet been infected. It was found that the rate of bleeding was elevated for 2 months after getting an infection, and there was a heightened risk of developing blood clots in the legs, or deep vein thrombosis, DVT, for up to 3 months after testing positive. An occurrence of DVT in the legs. Image. Central Florida vein. Looking deeper, it was also found that there was a higher risk of a patient suffering pulmonary embolisms, which is when a blood clot travels up the bloodstream and into the lungs and can potentially cause death, for up to 6 months following an infection. Then there was also the increased risk of internal bleeding and other linked problems, such as stroke, for up to 2 months after getting COVID-19. The numbers also showed, quite worryingly, that 4 in every 10,000 COVID-19 patients had developed DVT compared against 1 in every 10,000 individuals who did not get the virus, and also about 17 in every 10,000 COVID-19 patients had blood clots in the lung versus 1 in every 10,000 who didn't have COVID-19. Additionally, the risk of bleeding was about twice as high in COVID-19 patients in the month after getting infected, while the chances of getting DVT was almost 5 times higher. Despite the obvious evidence of blood clot complications following COVID-19, researchers are still yet to fully prove that the virus itself is the reason for them happening, although they have their own theories on why. One theory put forward is that such blood clots are the direct effect of the virus on the layer of cells which line blood vessels, while another one posits that they're simply an exaggerated inflammatory response to the virus. They say vaccines can help. The authors of the study concluded that these occurrences only pointed towards the benefits of getting vaccinated against the virus, as it was also noted that risk of blood clots were actually higher in the earlier waves of infections compared to those in later waves, hinting at the effects of better treatments and the efficacy of vaccines. Image. Reuters. Vaccination could reduce the overall risk both by preventing infection and by reducing its severity when it does occur, the study's authors wrote. One good piece of news, however, was that such risks proved to actually be declining over time as newer outbreaks of COVID-19 seem to be causing fewer complications compared to the earlier waves of infections. Still, the authors urged caution in this regard. Despite the potential for new variants of concern, most governments are removing restrictions and shifting their focus to determining how to best live with COVID, wrote Frederick Ho and Jill Pell from the University of Glasgow's Institute of Health and Wellbeing, who then added that the findings were a call to remain vigilant to the complications associated with even mild SARS-CoV-2 infections. Read more life stories. Adorable tiger cub rescued from smugglers in sting operation by Thai authorities. Mesian police to investigate couple who drove a Tesla hands-free to Penang. Singaporean proposes with a spectacular light show made up of 150 drones in the sky. Cover image sourced from Vaccine's work in European Pharmaceutical Review.